So here, first one is I'm going to discuss about the body weight. So this is a very very important. So to measure how the baby like a health, is it a normal body weight or is the low like a birth weight or maybe is the high birth weight. So how we can confirm it? Normally, if you any baby birth after normal delivery or maybe cesarean delivery, the baby should be like in the in between 2500 uh, grams to and 4000 is the normal. It will be two then nothing but is 2.5 kg to 3.24 kg is the normal weight. So if any more than the 4 kilo and 4.5 kilo, it indicates the overweight. So how we are going to classify this the birth weight? So according to the WHO standards, so the standards are is the if you see here the calculations here, the less than 1,000 grams, that is only 1 kilo. So if the baby after the full term baby are so they if they get anybody is the only 1 kilogram, that is the 1,000 grams, so it's extremely low birth weight. In between 1.5 kilo and also more than 1,000 grams or maybe is a 1 kilo, it indicates the very low birth weight. And also low birth weight is less than like a 2,500 grams, in between the 1.5 kg to the 2.5 kg. So if it is more than like a 4,000 grams, that is 4 kilos, it's called as the is a macrosomia. Macrosomia means the obese baby. Obese means like a more weight, as overweight baby is called as the like a macrosomia. So normally it should be the low birth weight is normally any infant less than 2.5 kg within the 1 hour of the birth weight. So why we have to consider it within the 1 hour? So if the baby reduce the weight or if the baby got the weight after birth 1 day or 2 days, this is the normal. After the delivery, the baby the may chance to get the weight reduction. So because of the water loss. But within the 1 hour, if the baby weight is less than 2.5 kilo is called as the low birth weight. So if you see the classification just now we done extremely low birth weight, very low birth weight, and also low birth weight. So if any baby comes to the like for the assessment, so we have to consider and also we have to categorize according to the weight. So what are the causes for the low birth weight? So many reasons are there for the low birth weight. So this low birth weight is most often caused by being born too early. So that means is the premature. Normally the mother deliver at the ninth month after the full term. But because of any other complications, if the faced by mother or maybe baby, so sometimes may chance to get the premature delivery. So that means they may chance to deliver before the 37 weeks. A premature baby has less time in the mother womb. So that means if the mother having any problem in the uterus or any infections, so it may chance to get the premature delivery. So and also much of the baby weight is gained during the last weeks of the pregnancy. So if the baby, like if the mother delivered the baby within the before the 37 weeks, in between 35 to 37, because of that time is the time for the baby weight gain. So if the baby deliver at the 35 to 37, so the baby weight is going to be maybe is going to decrease. They may chance to get the less weight. And also other causative factors, the major causative factors for the intrauterine growth restriction. Intrauterine means in the uterus, if any growth restrictions because of any infections or any problems, or maybe any problem in the placenta, the covering layer of the womb, or if related to the any health issues related to the mother and baby, so they may chance to get the intrauterine growth restriction. So these problems, this low birth weight, so is because of the two reasons, especially that is the intrauterine growth restrictions and also the mother and also baby health, any health issues. So this one is going to be having the because of the full term baby and also premature. The full term is going to be 37 to 41 weeks. So that is a normal. So they may deliver after 37. So most probably the baby is going to get the normal like a birth weight. But before that one may chance to get the low birth weight. Premature babies are these babies are both very small and physically and also immature. So they're going to be immature because of the last 2 weeks or 3 weeks are the very very important to get the weight. So these are the causative factors for the low birth weight. Why we have to know these things in the assessment and during the diagnosis time? Because we have to know while assessing the mother as well as the baby. So is there any premature delivery, or is there in the is the mature delivery? That means is the overdue delivery. Overdue delivery means sometimes after the 41 weeks also some mothers won't deliver because of any other complications, because of the any like a labor pains problems, so they may chance to deliver after the 41 weeks. So in in this time, so they may chance to get the other complications such as the microsomia. Microsomia is nothing but is the excessive weight of the baby. If it is more than 4 kilos, more than 4 to 4 4 point kilos may chance to get. So this is not if anybody having any risk factors may chance to get this macrosomia. So this going to be is macrosomia because of the so many reasons. So because of the if the weight or if the growth of the baby of the large fundus height, if the baby height is the bigger size, so may chance to get the macrosomia. And also in case of the increased amniotic fluid during the birth time, and also in pregnancy, if the mother having the is a excessive amount of amniotic fluid, that is the fluid is present in the placenta for the free movement for the baby and nutrition supplements for the baby. So the fluid, because excessive fluid also may chance to get the microsomia. And also other causative factors, if the mother having like a risk factors such as obesity is a high overweight, and also if the mother having any diabetes, and also some diabetes may chance to get in the only is during the pregnancy time, so which is called as gestational diabetes. So in those conditions may chance to get the risk factors, may chance to get the macrosomia. The baby weight also going to be increased. Other than these causative factors, if the mother having any previous history of the diabetes, or any family members having the diabetes also may chance to get. And also the mother gaining the weight in the during the pregnancy time, overweight. So and also excess weight gain. So normally until during the pregnancy, 13 to like sorry 11 to 13 kilo, the mother may chance to get the weight. So because of the physiological changes of the body, the water is going to be accumulated, and also the baby weight also increase. So all the changes are going to be happen because of the physiological changes in the during the pregnancy. But if it is more than cross the 11 kgs to 13 kgs, so it indicates excessive weight gain, so they may chance to get the microsomia baby. And also repetitive pregnancies, so who are getting the like repeatedly without taking the like a break in between the 1 year to 1 year. So the full-term babies takes a 9 months, so immediately within the 1 year, if they get after 9 months with a 1 month break or 2 months break, if they again they may if they get pregnancy, so they may chance to get the like a microsomia. And also if the baby child is the male, like a male child also may have a chance to get the microsomia. And overdue pregnancy, that means after the 41 weeks also if they are not getting delivery, so they may chance to get the macrosomia. And also any history of the fetal is a macrosomia. Fetal means in a family history, if anybody having macrosomia may chance to get. And also age of the mother also, if the mother age is like a more than 37 to 40 years, so they may chance to get up the this microsomia. So these are the causative factors for the high like a overweight baby.